Welcome to our podcast. My name is Amy Blum, and I am the Chief Operating Officer at the National Gaucher Foundation, an independent nonprofit dedicated to serving U.S. patients with Gaucher disease and their families. Through financial support, educational programming, patient services, and collaboration with medical professionals, the NGF empowers Gaucher patients to live a better today. To learn more about Gaucher disease and the work of the foundation, please visit gaucherdisease.org. Today's podcast focuses on a very important topic when it comes to genetic diseases and that of health in general, called precision medicine. I'm excited to introduce our special guest and longtime friend of the NGF, Dr. Pramod Mistry. Dr. Mistry is a professor of medicine and of pediatrics, professor of cellular and molecular physiology, and the director of Yale Lysosome Disease Center and the Gaucher Disease Treatment Center. He was born in Kenya and grew up in England. His clinical research and educational activities center around inherited metabolic liver diseases, and in particular, Gaucher disease. Dr. Mistry has been involved in the care of patients with Gaucher disease for more than 25 years. He proudly serves this patient population through membership of the advisory boards of the National Gaucher Foundation here in the U.S. and Project Hope's humanitarian program for children of the world suffering from Gaucher disease. Dr. Mistry, welcome to our podcast, and thank you again for joining us today.
Thank you very much, Amy. I appreciate your kind introduction and opportunity to participate with you on this podcast. Thanks.
Well, we're delighted to have you. And I know that the topic that we're going to be discussing is of great value to our community in terms of understanding precision medicine. So, I think a great place for us to start is actually defining precision medicine. So I would like you to give us your own definition or view of what precision medicine is.
In a sense, Amy, we've always practiced physician medicine in the sense that when patients with Gaucher disease, for example, came to the clinic, your doctor had always aimed to integrate signs and symptoms and evidence from their experience and work with patients to facilitate decision-making about timing and the type of treatment. And the precision medicine really came, the modern version of precision medicine really came into sharp focus with President Obama, who introduced the National Precision Medicine Initiative. Really, this is a way to enhance healthcare of the population as a whole based on deeper understanding of individual risks to particular diseases and individual responsiveness to specific therapies. And so just to give you an example in general medicine, for example, if you look at clinical trials, which usually involve tens of thousands of patients to say, for example, to look at effects of blood pressure lowering medication. What we've learned is that when there is a positive result, say if a drug A improves blood pressure, what we've learned is that usually this effect is driven by a very small number of individuals. And so the number needed to treat to effectively treat one person to improve their blood pressure is often as many as 10 individuals. So you would need to treat 10 individuals with the drug A to successfully lower blood pressure in one person. And so what the new era of genomic medicine promises is that we will be able to identify individuals with particular subtypes of, say, blood pressure or a particular disease, and then tailor therapy for that individual group of patients, so in order to get the maximum benefit of treatment. Now, genetic disease is different because we already know, for example, in Gaucher disease, that the patient has an enzyme deficiency. Often we also know what particular kind of mutation there is. And as I mentioned, in Gaucher disease, we do have a tradition of practicing precision medicine. But one implication of the precision medicine initiative is that there may come a time when you select drugs and time treatment based on particular mutations and what the mutations do. So translating a deeper understanding of the disease to the clinic to help physicians and patients make the right decision, to select the right treatment at the right time, is the centerpiece of this concept of precision medicine. And beyond genetic diseases, it is commonly used in cancer therapy, for example, and their particular drugs are selected based on the particular pathways that are driving cancer in that particular individual. And of course, the most striking example of precision medicine is when you select drugs based on patients' ability to metabolize particular drugs. And there are examples of this in a selection of blood thinners, Coumadin, for example, selection of medications for inflammatory bowel disease, such as Crohn's disease, and indeed more recently in Gaucher disease, when patients are evaluated for whether or not they qualify for treatment with Xarelto.
Right. And that is incredible and a very in-depth explanation that I know that our listeners are going to greatly appreciate. And you highlight a point that I would like to emphasize, which is that medicine for years has been highly personalized, which is sometimes used synonymously with precision medicine as personalized medicine, right? But we are choosing to use the term precision medicine precisely because the way in which physicians view their patients and determining treatment of anything from the everyday health needs to more significant needs, such as those that would present for individuals that have Gaucher disease, is already personalized, but now we're really going to delve into this concept of precision. And you touched on, in your definition, you touched on what I think would be considered pharmacogenetics, which is selecting particular drugs for treatment and then timing the treatment. Would that be a correct way to define pharmacogenetics?
Yes, Amy, I think that you put it very well. And so traditionally, pharmacogenomics have been used to identify patients who would benefit from a particular treatment and to determine what the dose of medication would be. And so there are good examples of that, particularly in use of Coumadin, for example. Some of the other drugs are used in treatment of heart attacks. have also lent themselves to pharmacogenomics. In Gaucher disease, in rare diseases, there are actually a very recent example where Sadelga, which is metabolized by cytochrome P450 system, is highly variable due to genetic differences between individuals. And one can do a genetic test to determine whether someone is a rapid metabolizer or a slow metabolizer, and that determines whether they require the treatment once daily or twice daily. Conversely, there is a minority of individuals who are ultra rapid metabolizers, and in these individuals, they never achieve a level of the drug to have a therapeutic effect. And so in this minority of patients, at the present time, this particular treatment is not recommended. And so this is a good model of how you can look at precision medicine, or indeed how pharmacogenetics, genomics can impact in the treatment decisions that are made in the clinic.
So, Dr. Mistry, when such precision medicine is considered, right, and in terms of selecting a particular medication and the timing of the treatment, are physicians really looking at the genotype, or are they also considering the phenotypic expression of a disease?
Amy, that's a really insightful question. And, for a very variable disease, Gaucher disease, for example, is so different from one person to another, and even within a family, there is extraordinary variability in pattern of disease. And so you quite rightly highlight that selecting a medication is not just based on metabolizer test, which is a genetic test to determine the metabolizer profile of the drug, Sadelga in this instance, and then writing a prescription. The bigger question when a physician sees a patient in the clinic is what is the current status of the disease? What is the unmet need in the individual patient? So if the patient is on treatment A, are there aspects of the disease that are poorly controlled? And is that because the patient is not on adequate treatment, dose, frequency, or maybe the patient is just not taking the medication? And then try and understand at a deeper level, what is the kind of a mechanism that might be driving that particular type of disease? And then you consider within that context, is there another treatment that offers greater value in terms of clinical outcomes? And that decision making is based on published peer-reviewed information from clinical studies, from individual centers, as well as ICGG registry, and then the profile of the patient that you're looking at. And so constantly you're transferring large data sets to try and inform your decision making for that one particular individual in the patient in the clinic.
So, and this leads really very much into the significant challenges that are perceived and real to many in the use of precision medicine. You know, we're at a time in history where there's so much that is changing, and but many will highlight some challenges in the broad implementation of precision medicine. And one is exactly to, I think, what you were just touching on, which is the methodology. And that for currently, as or in the past, and somewhat overlapping now with this currency of moving to more and more to precision medicine, is that we had in the past used so much evidence-based research that would drive best practices, right? And how that was obtained had to do with randomized clinical trials. And now what we see where medicine moving towards as precision medicine is being implemented more and more is it's more of an ongoing data collection, right, as part of this clinical care to observe different trends and inform how patients are treated. Is there anything that you as a physician that is highly tuned into this precision medicine sees as more of a challenge because you're not using, you're not solely relying on evidence-based research, but that you are, taking trends from a day-to-day and applying what you know to each of your patients in terms of deciding how to move their health care forward?
So this has been a topic, Amy, of a great deal of discussion in medicine about application of precision medicine to population as a whole. And I think that for rare genetic disease, such as Gaucher disease, there are specific caveats. But at a higher level, for example, the goal is to ensure that patients have very detailed medical information that can be linked to genomic data sets obtained through whole exome sequencing, and make this data available to the broader medical community to help and understand specific subtype of particular disease, understand the natural course of the disease in this subset of individuals, and understand the response to specific treatment. And those initiatives are now very well advanced. For example, in the VA, 1 million veterans are undergoing this kind of data capture. And then almost 300 individuals are participating in allowing their genomes to be sequenced. And so within the VA system, all of this data would be integrated to enhance care of patients. And this is truly a wonderful model. And there are similar models being pursued in Europe and other parts of the world. And I think in the next 5-10 year time frame, we are going to see quite a transformation in how we practice medicine. But of course, I think most of the listeners today are kind of trying to understand the impact of precision medicine in Gaucher disease. And one of the biggest challenges here is the rarity of the disease and the heterogeneity of the disease. And so one major challenge is how can we bring in physicians who are caring for maybe 3 or 4 patients together in a wider community of physician treaters who can share their data, where there might be a biorepository to do high-end genomic testing to really identify this subset of patients, understand their natural course, how their disease unfolds and responds to therapy. And to some extent, this has been achieved through registry. So, for example, the ICGG registry is now more than 20 years old, and it has accomplished a lot. And Dr. Weinreb, who you know, Dr. Grabowski, myself, and others have been participants in this registry for almost 2 decades, and it has really helped us to understand different patterns of disease in the natural history. What this registry lacks in a very significant manner is that we don't have a biorepository. So we don't have DNA samples to do whole genome sequencing. We don't have serum samples to look at biomarkers that can really help us to fine-tune and enhance our treatment of patients. And what the registry hasn't done so well, I believe, is that it hasn't brought in the smaller practices where there are only 2 or 3 patients. And my hope is that precision medicine initiative in Gaucher disease will create a community of doctors that will propel development of clinical phenotype data capture, development of a biorepository, DNA samples, and I think that that kind of initiative will greatly enhance our ability to care for patients with Gaucher disease wherever they are.
So do you see any conversations that are beginning to emerge within the community in terms of perhaps being able to expand what the registry currently is able to hold, or a completely separate development of biobanking, meaning that these DNA samples are actually captured and pulled in so that physicians for research purposes are able to look at de-identified data. And I think the reason why I want to emphasize that is that, as you've pointed out, precision medicine for those within the Gaucher community or other rare disease communities could be viewed differently than a broader implementation of precision medicine, because it is such a small community, and we're looking for identifying these patterns and the similarities in phenotypic expression of the diseases. And there's probably a portion of the larger, broader population that is hesitant in terms of the possible implications of biobanking because of privacy and regulations that may or may not exist in today's day pertaining to security and how that kind of data is being held. But there is tremendous knowledge to be gained and leaps forward to be able to be made in terms of how our Gaucher community could be treated if such a biobank existed. So I'm just curious if there's any kind of conversations in process now as far as how to perhaps develop such a biobank for the greater Gaucher community.
So, Amy, you identify a very important topic that we really must engage in, and thanks for your leadership in highlighting this. A few years ago, Dr. Grabowski, myself, and others in the ICGG registry did discuss the possibility of developing a biobank together with the ICGG registry. Again, as you quite rightly point out, there are important issues regarding confidentiality of data and patients' right to decide if they want to withdraw their specimens from the biobank, to have a clear process for them to have that path. And I think that that is already well developed in any kind of research that you take part in. That if at any point a individual feels that they want to have their biorepository material destroyed, all it takes is a letter to the principal investigator. One of the challenges arises when there is an interface of industry with holding of patient clinical information and holding of biorepository. ICGG registry, which is now almost 25 years old, has actually done a really good job, in my opinion and in opinion of many others, that it has handled confidential patient data in a very responsible way. There is a governance board of physicians who make the decision, and the operational support for the registry is provided by Gen Sanofi company. There has also been a lot of discussion whether for rare diseases which have very expensive therapies, whether it would make sense to have an independent registry and have an independent biobank. One of the biggest challenges with that is that having even a registry is a very expensive undertaking, costing tens of millions of dollars. And there's just not that kind of funding or the infrastructure to store a biobank available. And this remains a significant ongoing challenge. Where would the biobank be stored? What kind of freezers you would store them? Who is going to man these freezers? What are going to be the safety parameters and systems put in place to make sure that if there's a power cut, that we don't lose that entire biorepository? So the logistics of this is really quite challenging to do this on a national basis. And so what some of the larger programs have done is that they've developed their own system to develop a biobank over a period of time. So investigators develop their own individual system to capture clinical data longitudinally and also maintain the biobank. But at best, even the largest centers are going to have 200 patients. And I think in the next era of delineation of Gaucher disease, we really need to have the power of looking at clinical data and the biorepository of thousands of patients, not just hundreds of patients. And this is a topic that I'm glad the NGF and you are starting this discussion on.
Yeah, no, this is really fascinating, and I'm so glad that we're having this conversation. The NGF has been engaging in some of these conversations that I know are broader, and it almost sounds as if from everything that you've been sharing that there could also be some real benefit for consideration of a national rare disease biobank, right? So that, again, these patterns and similarities between signs and symptoms in different diseases can be tweezed out, and researchers can be looking at very specific exomes, I guess, it might be where I'm going with this, to see and or to further enhance our understanding of the various rare diseases and their relationships, if any. So it certainly sounds like there's a lot of exciting things that are on the horizon, but that yet it could be even the distant horizon because there are challenges in terms of financially being able to develop, and then of course the regulations and conversations about how such a biobank would be established. Is there, to your knowledge, current research specifically for Gaucher disease being used or being conducted that uses precision medicine?
So one of the, in relation to your question, I think one central topic that is important both to patients as well as physicians is what is the basis of this extreme phenotypic variability in Gaucher disease? And most patients who come to my clinic, adults, and even some, parents of children, is what is their risk of Parkinson's disease and Lewy body dementia? And this association between Gaucher disease and Lewy body dementia and Parkinson's disease have struck fear into the hearts of patients and families that are affected. The important thing to keep in mind is that 95% of individuals do not ever, thankfully, suffer this complication. And yet, that 5% who is at risk, they want to know ahead of the time. And there may well be therapies that are effective in preventing this complication in not too distant future. And so there are enormous efforts underway at the moment to discover what are the genetic and possibly other types of modifiers that predispose somebody with GBA mutation to go on to develop Parkinson's disease with or without Lewy body dementia. And this effort is being propelled not only by investigators in Gaucher disease in Europe, as well as United States. At the NIH with Dr. Sidransky, our group is very focused on that as well here at Yale. But also the Parkinson's disease community is initiating some very ambitious studies looking at heterozygote carriers, thousands of them, to try and use genome-wide association studies as well as whole exome studies to discover that genetic modifier. And that would be and with the prospect of potential therapies that will control this problem, that really is a model of precision medicine. That a patient would come to our clinic, they are concerned about their risk of Parkinson's disease, and rather than telling them that, look, don't worry about this, you've got a 95% chance of not having this feared complication, what we will do is do a test and tell them, no, either you're going to have this complication or stop worrying about it. And if you are in the risk group, then one can then consider and discuss therapies that can treat not only Gaucher disease, but prevent the development of this kind of complication. So that's the bigger kind of goal that a lot of investigators are pursuing at the present time. And there is some encouraging initial data that we may actually come to that stage in how we manage Gaucher disease and specific complications. And that may even expand, for example, to risk of cancer, a risk of other complications. Say, for example, a child who is found to be homozygous for N370S mutation because both parents are carriers. And there are many such individuals who can go through life without coming to any harm, but clearly a subset do become quite sick. And is there any way to identify those individuals ahead of the time to stop them becoming disabled from complications of Gaucher disease. And so I think that this initiative is going to involve genomics, but I'm sure it is going to involve the use of biomarkers, which will be an important part of precision medicine in Gaucher disease and indeed in other diseases too.
This is all very exciting news and extremely informative. And I know that our greater community is going to have a tremendous interest and appreciation for this particular podcast topic, because it really touches on the here and now and really deep concerns that our patient community has, and to know what our physician community is working towards to help create a better today for each and every patient. And I know that we could continue our conversation for a tremendously longer period of time, but unfortunately, that's all that we have time for today. So I thank you, Dr. Mistry, for leading us through this important discussion. We really appreciate your wisdom and your time.
It's been a real pleasure, Amy. Thank you so much.
And I also thank you to our listeners. Once again, if you want to learn more about Gaucher disease or the National Gaucher Foundation, please visit gaucherdisease.org. That's GAUCHERDISEASE.org. You can sign up for our monthly newsletter, read articles and blog posts about living with Gaucher disease, hear more of our podcasts that we've previously recorded, as well as learn more by seeing patient stories and videos. You can also follow us on Facebook. Please check back for future podcasts from the National Gaucher Foundation. Thank you, and we hope you'll join us again next time.